Hi, this is Jill from Physio, and today I'm here with Emily to just discuss a little bit about how to stretch our hip flexors so that we do not cause ourselves pressure into our lower back. People that have lower back pain often have tight hips, which causes a lot of increased curve and pressure in their lower backs. This is a good way to gently reduce that tension in your lower back, and I'm going to show you a quick correction in a few different ways so that you don't have that pressure and pain in your lower back as you're working on it. So I'm going to have Emily go ahead and lay back. She can grab that knee to chest. This is one you can actually do on your own off the edge of the bed, or you can have somebody help you with it. So what we're watching for here is, I'm going to ask Emily, are you feeling like you're having some pressure in the lower back just in this position? So I'm going to go ahead and ask her to do a pelvic tilt by tucking her tailbone under, and that's going to take that pressure off the lower back. Does that feel better in the lower back? Okay, very good. And you can see as we tuck the pelvis under that you can see the tightness in the hip flexor here. Ideally, we want this to be coming a little bit closer to the table. And as we gently stretch that, it will release. So give that a try if you're having tension or pain in the lower back. Just do a little pelvic tilt, tuck the tailbone under, and that should help relieve that pain. So now I'm going to show you two different ways to stretch if you want to try a different position. You can come into a half kneel position, and you're going to keep the same thing in mind. So, yep, knee right there, bring that foot forward, good. So you can see right here, go ahead and arch your back just to show. So if you come forward and you're really arching into the lower back, more than likely if you have back pain, you're going to feel pinching in that lower back. So oftentimes what works better is to come on back here, tuck that pelvis under, do a little tilt, good, see the difference there. Now come forward. You're not going to have as much range of motion, but you're going to get a more effective stretch in the hip flexor, and you're not going to have that pinching pain. The last way you can try it is in a standing position into a half lunge. Same sort of deal. You want to make sure that you're tucking the pelvis under first, so that's, yep, doing the opposite. And then coming forward with a little bend to the knee. Anytime you stretch a muscle group, you want to stretch it for a total of a minute. So whether that's 3 sets of 20 or 2 sets of 30 or just 1 minute, 3 times a week of 1 minute stretching the muscle group is how you're going to see appreciable change. Try them out, and if you have any more questions, look us up or give us a call, prophysiomt.com.